I'm interviewing a Dr. Christine Sauer. She is a MD as well as a naturopathic doctor who grew up in Germany, now in Canada. She has written several books, The F Word Diet, Eating for Vibrant Health, and My Daily Sparkle and Gratitude. So we'll ask her about each of those, and just does a lot of health and wellness coaching. And so we're just going to kind of pick her brain today and see where the conversation goes. So, Dr. Sauer, welcome to the show.
Thanks, Greg, and I'm happy to be on the show. And since we're both doctors, usually we don't say the doctor. That's fine with me.
Okay, very nice. Um, well, tell us, I guess, if you will, a little bit about your story. You were, grew up in Germany and trained as a physician, end up moving to Canada, and as I mentioned, now you kind of practice more, wellness type medicine. So, just kind of talk about that transition for you and why you kind of switched what you were doing. Just tell us a little bit about you and what you do.
I'd be happy to. So I grew up in Germany and I became a physician, a naturopath, which is not an unusual combination in Germany, interestingly. And I married, had children, the typical wife thing. And I still worked in the family practice that we together had and was very successful by all means, opened my own dermatology practice, one of the only ones in Germany that had 6 weeks wait time. I had a lot of fun, but I worked 14 to 16 hours. It was
Mm.
way too much. The stress was too much. My marriage was not happy. The children were hard to manage. They grew older, teenagers, and I didn't know what to do with them, honestly, at that point. So something had to give, the stress, it affects your health. So for me, it started with back pain. So I got back pain, and it started one day. I never had back pain before. And that evening, I was in severe pain and just made it home in bed. The next morning, I couldn't walk. So I went to the hospital, had to learn to walk again. I had two slipped discs, took me 4 weeks. I walked again. I started to work. Next disc slipped. So I gave up medicine because I couldn't work. And then the second thing hit my ex-husband, he decided to commit suicide. So I wasn't feeling good. And we
Mm.
had immigration papers to Canada before that. So I thought, well, how about everything ended here anyway? Let's go to Canada, make a new start. It was kind of a dab in the unknown. And the children were 15, 16 at the time. And they didn't know what was expecting them. I didn't know it. And so we went to Halifax. It was in the end, it came the best decision, but at the moment it was very hard. I fell in a deep depression because medicine had been my passion, my purpose, and I had nothing besides it. So I was really depressed. And at one point I tried to commit suicide. By the way, that's interesting thing because I was on antidepressant as I gave everybody. But then the psychiatrist, that was 1998, decided to triple my dosage. And that triggered me to try to commit suicide,
Mm.
which we well know now as a side effect of SSRIs. I'm not a big fan anymore, obviously. And so I ended up in a psychiatric hospital for 4 weeks. I
Mm.
was really miserable for many, many months. And slowly then I pulled myself out by the hair of the hole. And then at some point, it was years later, I already had met my new husband. He's from here, from Halifax, a wonderful guy. And I reinvented my life. And I said to myself, the decision that people make that are chronically ill. I had chronic back pain. I was on morphine. I was on codeine. I was on psychiatric drugs. I was not living. I was existing. So I said to myself one day, that is not the life I want to live. I want to have a different life. I want to be able to connect back with my purpose and make a difference in people's lives. Now, I could have gotten my medical license, but they lied to me too from the medical establishment. They said, oh, just take those tests and then you can work as a physician after you worked with a few other doctors for a few months. So I took the LMCC 1 and 2, I passed them. And then I went back to the College of Physicians and they told me, oh, no, you're not from a Commonwealth state. You need a new residency. So at that
Mm.
point, my question was, is there part-time residencies? And the answer was no, with no options. So that didn't help my depression. So over time, and I laugh at it now because it's long ago. So then I made my decision. I want to do something else. What can I do as an unlicensed physician and naturopath? Hmm. But I thought I become a health coach. Why not? And doing everything wrong, thinking just, oh, become a health coach, put a website up and people will come. And like many health and wellness coaches realize, it's like putting a billboard in the desert. Nothing exactly happens because people don't know you. And I dabbled a little bit local, but I happen to live in the smallest province in Nova Scotia, that in the smallest province, one of the smaller ones, and one of the poorest provinces in Canada, where the people have a very negative mindset that I was trying to change, but not very successfully. So at some point, I realized what I was doing best. I took, like many coaches, more education. I aligned myself with Dr. Daniel Amen, Change Your Brain, Change Your Life. I took myself against the advice of my local physicians, kind of funny, of all medications, replaced them by natural supplements and lifestyle options. And then I decided, why not write some books and about what I know and publish them myself, published them. I wrote collaborative books that have become bestsellers, which is nice. I did a TEDx talk that didn't get published on TEDx because it wasn't streamlined enough. But I have the recording because it was recorded during COVID, which is nice. So, and I share that with clients. I just published it under a different name. It's okay. It is what it is. So it's interesting. And now I work mostly with what I call holistic brain care. I help people to rehabilitate their brains like I did mine, because psychiatric medications damage the brain. And it takes months, if not years, to rehabilitate the brain to function again, to be able to really think and think clearly, get rid of the brain fog. Now, at the same point, I was overweight. I was 150 pounds overweight. So in 2006, we went and had weight loss surgery in India, was the cheapest option. And I have kept the weight off since then, which is another thing, because it's not so hard to lose the weight, as you know. It's harder to keep it up, keep it off. So I now focus on helping people with different issues like weight loss problems that have emotional eating issues too, because I'm good in both areas. Many people that are depressed, either they don't want to eat, then they lose weight, or they eat extra, then they gain weight. And then I noticed many of my depressed and overweight clients had, and I don't call them patients, I call them clients, they had inflammation. And inflammation contributes not just to weight issues, but also to depression and many, many other health issues. And at the same point, the gut health was very important. So I took a gastrointestinal mastery course to be able to interpret the organic acid test properly and help those clients with bio-individual nutrition. And so I expanded to children and youth with ADHD and autism, because it's a very important group of people nowadays that are doled psychiatric medications and they are damaged for life unnecessarily. And I'm not totally against those medications. I'm against the long-term use of those medications.
Yeah.
So that's my story.
Yeah. Well, congratulations on your transformation and, getting off all those, drugs. So let's talk about that a minute, because looking at your website and stuff, you kind of specialize in a lot of mental health. And as you well know, and listeners well know, that, kind of conventional medicine, if you go in and say you're anxious, you're depressed, first thing they're going to do is put you on a SSRI, which is, Paxil, Prozac, Lexapro, Celexa. There's a number of them. And certainly those are not without side effects. But so talk about your approach to mental health and how you help people, through supplements. I don't know, what are your typical recommendations when you're working with somebody specifically for depression, anxiety, those type things?
Well, typically the people that come to me, they have a very long history of mental health issues because they have tried conventional options. They are on medication. Sometimes they even have tried TMS or other options and they just didn't get better. And now they want to go to the causes of the whole thing and want to finally get the help they know they can get. They somewhere know they have. So I developed actually a program and strategy to help those because it's the same story that I had. It's for years, and at some point you had enough. You want to get better, and I call that to sparkle because you recognize it. When you see somebody that's really depressed, their eyes are dead, but then when you rehabilitated it and you look them in the eyes, they sparkle, they have that joy, the energy, the vitality back. That's what the clients want. So I can help them. And we always start with what I call a 5-dimensional holistic health assessment, where I really go in depth. And it's a series of online questionnaires where I ask all the questions. I determine the brain type. I use the questionnaires developed by Dr. Daniel Amen and some modifications by myself. I find out what type of depression or anxiety, if they have. If it's children, what type of ADHD? If adults, what type of ADHD or attention deficit? It's really not a valid diagnosis in my books. It's totally over diagnosed. Those label, I call it labels. They label you as sick. It's terrible, especially for children. They learn that they're victims now and they settle in that instead of reaching for their potential. And from there, I go then and coach them around what they need to do. So we develop what I call a life strategy plan, which includes supplements, a nutrition plan, an exercise plan, and the whole gamut of lifestyle options that really in the Western world we lost. But in many countries and cultures, and even when I in Germany, when I trained as a naturopath, we learned about all those options like hydrotherapy. It's great, balneotherapy. It's wonderful. And people don't even know that in the morning a cold shower resets their adrenals, whereas in the evening, it's better to have a warm shower if you want to sleep. Those basics are totally lost. It's sad. So that's
Yeah.
what I do with clients. And after about a year or so, they are from sad to sparkle. And I'm not taking them off the medicines to start with because there are withdrawal symptoms and they can be
Sure.
severe. And
Yeah.
many have
Yeah.
tried just to take them, no longer take them. So if anybody listens to that and takes those, don't suddenly stop them.
Sure.
Get
Yeah.
an
Yeah.
experienced practitioner to put you on a targeted plan, or you will have severe withdrawals. I
Yeah.
don't want that for you. It's terrible.
For sure. So what supplements do you like specific for depression, and or anxiety?
That's a very interesting question, and there's not typical supplements. I make an individualized plan for everybody because I find there's not one supplement that helps everybody, and it depends on many factors. Now, generally, anybody should take a very good multivitamin mineral. Pretty much anybody is deficient in vitamin D and K2. Pretty much everybody needs magnesium. Pretty much anybody needs omega-3 fish oil or the vegetarian alternative, which is krill oil, and not krill oil, which is a phytoplankton, marine algae derived omega-3s. That's really basics. And then, of course, it depends on their situation. There may be certain B vitamins, there may be zinc, and that's what the the organic acid tests help to determine what they really benefit from. And I did the courses from Julie Matthew on bio-individual nutrition, which goes very deep into the biochemistry. I'm a fan of biochemistry and Krebs cycle, and I try to optimize it without breaking the bank and without many patients fall to the fallacies that either buy something that's really expensive that they don't need, but they have not, the basics are not right. They don't eat anything healthy. I mean, I'm sorry, if you are Twinkies all day, the best supplements can't get you healthy.
Yeah, for sure. Yeah. Okay. Well, let me ask you about your book. So you've written several books. One is called The F Word Diet.
Yeah, it's a fun project of mine.
Yeah, so give us just kind of a brief summary of that book.
The effort diet is about is for people that are overweight and label themselves with the effort. They look in the mirror and they say, "Oh, I hate what I'm seeing. I can't stand myself. I don't know what to do, so I better eat some more." Because that's a typical reaction when we look in the mirror. And I was like that. I looked in the mirror. I hated what I see. I got bigger and bigger. And I said to myself, oh, F that. So I had that idea. And then I made it as one of the books that actually helped with, to establish. It's actually it's a conversation between a doctor and a patient, a fictional patient. So it's a half an informative book and it's half an entertaining book, because I didn't want to write another textbook. There's lots of them out there. The Obesity Code by Jason Fung is excellent, or stuff like that.
Mm-hmm.
They're
Mm-hmm.
long and this is a book that's easy to read. The Effort Diet, it's really easy to read, and it has information about intermittent fasting, which in my opinion is one of the best methods, at least to start losing weight. And we know that it helps with longevity, which is your
Mm-hmm.
specialty too, and it helps with persistent weight loss, and it liberates people from that constant deprivation thing that many weight loss patients go on. I can't eat that. I'm not allowed. But if you're not allowed, your brain says, "Oh, you don't want it," and then they eat.
Yeah. So you wrote another book called Eating for Vibrant Health, which I love that title because my clinic's name is Vibrant Life, and so
Yes.
love that. So what? Tell us about that, and maybe what's different about that book than the other diet book.
I wrote the Eating for Vibrant Health and Explosive Energy for my clients, really, because I got always asked, what can I eat when I go to the grocery store? What should I choose? So I made it very simple, and I broke down the food groups, and I classified each food groups in three parts: what is recommended or optimal to eat, what is acceptable if you can't afford or get what's optimal, because I live in the northern climates, we don't always get the optimal food, and many people can't afford organic or biodynamic food, which obviously is best. And then what better to avoid. And in the beginning, I write a few articles about what I think about food quality, food preparation, processing food, and the difference between fresh, local, and has been on the store shelves for 6 weeks and still look good.
Mm-hmm. Yeah.
Uh,
Okay. And then lastly, you wrote a book called My Daily Sparkle and Gratitude. And
My
so
Daily
tell us a
Sparkle
little
of
bit about
Gratitude, a
that.
journal to brighten your day. Now, I wrote that for my mental health clients that need to have a little bit more established that gratitude attitude. It's not really a habit. I had a client tell me, oh, I have to do that gratitude thing, like it was a task. No, it's an attitude that we have in every moment. Right now, I'm grateful for so many things at once, for being with you, for having electricity, or just basic things. We can have an attitude of gratitude. And Dr. Amen, one of my mentors, he said in the brain scans, we can see that being grateful equalizes the brain and makes it function better.
Mm-hmm. Yeah. Okay. Well, good deal. So you also host your own podcast, and it's called Sparkles for Mental Health. So tell us a little bit about that, how long you've been doing it, and just maybe some of the topics that you discuss on the podcast.
Well, I started that podcast in 2017 as a local radio show, and I called it Healthy Alternatives, which is okay, but it was really non-descriptive. And over time, when I developed my real love for mental health focus, I said, all my guests, I always had guests, and they share stories of struggle and overcoming that struggle. And the mental capacity, the brain, the mindset is so important for tenacity, for getting out of the hole, overcoming challenges that inevitably life throws at you. So then I thought, I rebrand it as Sparkles for Mental Health, because really that's what I'm talking about. how we can grow personal growth in 5 dimensions, in all 5 dimensions: physical, mental, social, spiritual, and financial. And I
Okay.
have people of all walks of life on it, from a pastor to fitness guys like you, and holistic and functional doctors that sometimes, and even I had people that are, Ron Williams was a bodybuilder, a natural bodybuilder, great guy.
Okay. Okay. Well, very cool. Um, all right. Well, are you still with me?
I am. My computer
There you go.
freezing.
Okay. I'm sorry. Yeah, it paused there for a second. It kind of froze. So, so sometimes I like asking people about their kind of daily routine. So you said you like intermittent fasting. I mean, you've written books on diet. So tell us what a typical day looks like for you as far as eating, exercise, fasting, your kind of what you do for mental health, meditation, whatever. You don't have to go into detail, but just kind of tell us what a general day looks like for you.
That's a very good question. Thank you. And I don't really spend much time anymore on it. What I do in the morning, I usually get up between 4 and 5 because I'm a morning person. And the first thing that everybody should do, that's actually a good tip for anybody. When you get up, before you even get up, you put your legs out of the side, put your naked feet on the floor, feel the cool ground, stretch your arms in the air, and says, it's going to be a great day. And if you like affirmations, you can say them then. And then you go to the washroom and start your day. And it has already started as a good day. That's crucial for mental health. Now, then I usually go in the kitchen because my husband is still sleeping. And then I have my 3-minute exercise because I'm lazy. I don't like to go to the gym. I do my exercise at home. I do intentional, intuitive movement. That means in everything I do, even when I'm sitting on the computer, I engage as many muscle groups as I can. And there's also where the mindfulness comes in, because I did Tai Chi for a while and I like certain forms of yoga, not all. But and that is important too, because it combines the strengthening of the body with mindfulness and mental calmness, which is very important. And then I start my day. I usually have a cup of coffee. Why not? And I have whatever for breakfast. I cannot eat for breakfast, and I experimented with that. I cannot have anything carb rich. For example, even nuts or organic oatmeal or something. I cannot have that. It makes me tired. In the morning, I need protein, so I usually have an egg and bacon or something like that. And then I can start my day. And I'm not on the computer. I'm very busy. So usually I don't do much. I get up every now and then and do some Tai Chi exercises. And or I do the 3-minute exercise by Zach Bush to get my energy back and help a little bit. And then after the end of my workday, and workday for a coach is often a little cut up, I'll walk my dog sometimes when the weather's nice and my neighbors think I'm crazy because I move my whole body when I walk. I'm not just flop, flop, flop. That's my idea of intentional intuitive exercise. That's how I keep my weight off. I use my muscles every day, but not by going to the gym, but by using them for every little move that I do during the day. And that way, I still have muscle mass and I still burn more energy than most people that just sit on the Chesterfield do nothing. Of course, if you like the gym, if you want to go to the gym, it's great. I don't mind the gym. I just don't take the time to go there. But if it's a good gym, you like it, by all means. And in the evening, usually my husband cooks, and we like good vegetables. We like meat. Meat is wonderful. The more the animals are natural, we used to have chickens. Now that was gorgeous. Fresh eggs from chickens that are on the grass, that eat the herbs. They were so wonderful. Now we get them from a farmer nearby. Not as good as our own were, but they were good. And it's fun to see the chickens actually in nature and walk. When you look out of the window, you see the chickens walking around. they're such sweet animals. I spoke at the Toastmaster, the chicken, the misunderstood animals. I don't like chickens being confined to those cage batteries. I think it's cruel to the chickens.
Yeah. Okay. Yeah.
I have no problem eating chicken and killing animals, but I have a problem being cruel to animals. This is not
Sure.
the same. And I think it's important to distinct that, because some vegetarians and vegans are very, very, let's say, they say every killing an animal is bad. And I disagree.
Mhm. Yeah. Yeah. Okay. All right. Well, very nice. So your website is Doc Christine, and that's DocChristine.com.
Mhm.
Is that the best place that people can learn more about you and your services and what you do?
Absolutely. I
Okay.
just had a big makeover. The website looks nice and is much more functional than what I did myself before. So yes, DocChristine.com by all means. And if you
Okay.
Google my name, you land somewhere where my website link is.
Okay. All right. And then once again, your podcast is Sparkles for Mental Health. So,
Mhm.
okay. Well, as we wrap up here, I always ask my guest if they could give us one health tip that would make us healthier today. What would you say to that?
I think the most important tip is when you do something, be fully with it and do not try to do 10 things at once. And try to do one thing after another in the right order. This is really good for health. And don't feel bad if you make mistakes, because we all do. And it's not helpful. If so many people nowadays are stressed, and on my website and otherwise, I have a little video that I give away for free with the course. I call it the Instant Calm Formula, because I help people to de-stress and calm anxiety and voice in less than 10 minutes. So I invite you, if stress is one of your problems, go there and get your instant calm formula. It's really good.
Okay. Okay. All right. Well, thank you so much for just sharing your story and a little bit more about what you do. And so, uh, would encourage everyone to just check out her stuff. And so, as always, I appreciate everyone listening, and we will talk to you next time.
Thank you.
Okay. Yep.
Hi, folks, and welcome to Sparkles for Better Mental Health, Growth in 5 Dimensions. And today I'm extremely happy to have a new friend of mine, Dr. Greg Dennis, on the show. Hello, and you're from Oklahoma in the States.
Yes, ma'am. Yes. Thank you for having me.
I'm very happy to have you. Now, tell me a little bit about yourself. I know you're practicing as a physician in Oklahoma. How did you get
Mhm.
to become the person you are today?
Yeah. Well, so yes, I'm a family practice physician in Oklahoma, as you mentioned, and I, along with my wife, we have a practice called direct primary care. So, for those not familiar with that, direct primary care is where we've gotten away from the insurance model, which is, kind of corrupt. That's a whole nother topic. But and so we just people pay a monthly membership, and so with that they can see us as much as they want. Basically, they can text us, message us, and and when you get away from the insurance, then you're free to kind of practice how you see fit. And I've found since doing this style of practice that when you take all the middle people out, it's actually not that expensive. You can get MRIs for really cheap. You can get labs for really cheap. And so that's been kind of cool. But when you're, not under the corporate medicine umbrella, if you will, and the insurance, then you can really practice to make people well and really get to the root problem. And we have a lot more time with patients. And so that's what the direct primary care model is. And then I would say, I'll go a step beyond that. And we really try to practice wellness-based medicine, which is, once again, trying to get to the root cause. And instead of just throwing medicine at them like conventional medicine does, we try to get them off medicine. Now, I'm not anti-medicine, but it's hard to optimize one's health, which is what we really strive to do when people are on, a dozen different medications. And so I practiced in the corporate medicine world for many, many years. I had a huge practice and practiced what I call evidence-based medicine, which is kind of a scam in and of itself. And I was lucky because one day I just kind of had this epiphany that my patients weren't getting any better, even though I was doing everything in the standard of care. So if they had high cholesterol, I was putting them on cholesterol medicine, and I was throwing all these medications at them for their diabetes. And so on paper, they looked good. Their cholesterol was low, their blood sugar looked good, but they were still overweight. They had arthritis. They were miserable. They were still dying of heart disease. They were still having stroke. They were having all these chronic illnesses, and they weren't well. And so one day I just thought, there's got to be a better way. And so I went on this kind of deep dive and just really started learning on my own. I've always been into fitness and health and wellness, but I never really practiced medicine that way because that's not how I was taught. And so I went on this deep dive, and the more I kept learning, the more I was like, well, that's not what I was taught. And so I started implementing some things when I was still in corporate medicine and realized that I could actually heal people. I could actually, in many cases, reverse type 2 diabetes. And nobody ever told me that. And so the more I kept going, into that, it was not, it wasn't a very good fit to be in that setting anymore. And so I joined my wife in what we're doing now in a clinic that's called Vibrant Life Direct Care. And we just opened our second location here in Oklahoma. So.
Wow, that's gorgeous. And I love the way you said that, how you slowly just found out that really what conventional medicine does is mostly putting band-aid fixes on in the form of medication. And if it is
Sure.
not good enough, they throw a second medication on it instead of at least offering the patients some lifestyle options with the and giving them the hope that if they implement it, actually they can reverse diabetes.
Mm-hmm.
And not just that, they can get their sparkle back, as I say. They can get their mental health back. And they
Yeah.
don't need all those drugs that they supposedly do. And I find it very obvious in the mental health field. What's your experience with that?
Yeah. Well, for sure. I mentioned, diabetes as an example, but you could take mental health, you could take in many autoimmune diseases. I mean, there's a lot of these chronic type illnesses that conventional medicine just doesn't have a good answer to, and just, again, throws medication at them. And then, as you mentioned, if it doesn't work, you throw a second and a third medication. And so now, it's this, what I refer to as a sick model of healthcare. I mean, so it's just these patients are in this vicious cycle. So now not only are they not better with their mental health or their diabetes or whatever, well, now they're on 5 or 6 medications and probably having some side effects from those medications. And so their chronic condition is not any better or worse. And now you have all these compounding effects from the medications. And so their life is just miserable. And that's when we get a lot of people, they're fed up with the, with the traditional system, and they'll find us and they're like, I've been doing this for years and years. I'm on this sack full of medication and I'm not any better. Like, I feel like crap. And so we'll get somebody in there or in here, and we'll start working with them to really try to figure out the root cause. And most of the time it all goes back to lifestyle, a lot of it. And things for your mental health, which is kind of your specialty, or their diet and their sleep patterns, and their physical activity and all those things. And it's unfortunate that conventional medicine doesn't even recognize any of that. And I guess probably because there's no money in that. Unfortunately, I think it all comes back to that. So
Money for whom is a question, and we both know for whom the money is supposed to go, because it's the pharmaceutical industry and the
absolutely,
agroceutical industry, and those make the big money, and they steer the politics, and it is
with
very obvious to many people now, and that's the one that come to people like yourself and me, because
without a
they're
doubt.
fed up, literally fed up with the food that they get,
Yeah.
because it's not really fake, it's fake
Yeah.
food now.
And you know, now that I'm on this side of it, looking back, I'm
Mhm.
like, how I mean, I'm fortunate that I was able to now see it for what it is, but I'm like, I'm surprised that more doctors, I mean, because these are educated people, and they're good meaning people. I mean,
Mm.
I still got a lot of friends that, practice, kind of conventional medicine, but I'm surprised that more people don't see it, for what it is, because most of the time with conventional medicine, especially as it pertains to chronic disease, that people don't get better. And now medicine does great for acute stuff and for trauma and things like that, but for the treatment and certainly prevention of chronic disease, it does nothing, and many times makes things worse. And so I'm really surprised that more uh, doctors
Mm.
just don't see that.
That's a good point. What's your idea why that is? Do you have any?
I think it's just because that's the way they're taught, and when you come up in a medical system, and as a young person not knowing anything, and then you look up to these faculty members who are really smart, and they tell you this is the way it is, and this is evidence-based medicine, and you don't question it, and if you question it, then you're a quack. And so we just it's almost a brainwashing. I'll be real honest. It's almost a
Yeah,
brainwashing. And again, I think these are good-willed people, but
yeah.
so we come up in the system kind of brainwashed to do this, and to just practice this what we call quote evidence-based medicine. And so I just think they don't know what they don't know, and they just can't see past what they've been taught, and it's been indoctrinated in them that this is the only way. And so I think that's why. And again, I did it for years and years, never questioned it. And even when people would come to me and say, hey, I found this alternative treatment that I saw online, what do you think about it? And I'd just blow it off, and I would say, oh no, I practice evidence-based medicine. And so anyways, I like to tell people I'm reformed. I'm a reformed conventional medicine doctor, because I've been able to see it for what it is. So I will say that with this recent pandemic, more people have opened their eyes, and it exposed a lot of our conventional medical system, and so people
Mm.
have a lot more distrust in it than they used to. And so if anything good came out of the pandemic, it was that.
I couldn't agree more with that, because the pandemic was very unfortunate the way it unfolded, and the way the government regimented what later turned out to be a big disaster. And
Mm-hmm.
it's still not fully known how bad it really is. But that's another point. But I agree. And the sad thing is, what I see when I talk with especially middle-aged and older physicians, and some of them are my clients, because they don't want to go through insurance. They're afraid that somebody will find out what's going on, and then they lose their license. So then if they need the income, the licensing for physicians is quite a secure way to make money. And it's a big hurdle to throw out your license when you do what they call still alternative medicine
Mm-hmm.
and go into the private system. And it can be quite a deterrent for physicians. And I think that the physician burnouts that we are seeing, the increasing, is not so much a work overload. I think it is this mental conflict between
Mm-hmm.
what they experience as value, they want to help their clients, and the conflict between what their regulators force them to say and do. if they want to keep their license. That's a chronic conflict. And we know that
Mhm.
those chronic conflicts are mentally so stressful that they can cause depression and burnout.
Yeah, for sure. Like I said, I think most people in this field are good-willed and they
Yes.
want to do best, even though they may still trust the conventional treatments.
Oh, yeah.
But most of them, again, want to do best by their patients. But you're right, when they're in the corporate setting, many times their hands are tied, and unfortunately it's not getting better. It's getting worse. I was in it for almost 15 years, and just in that what I call short amount of time, it changed so much. And even I've been out of it for about 2 years, a little over 2 years now, and just kind of keeping in touch with people, talking to people. It's even worse now than it was 2 years ago when I left.
Mm.
And so unfortunately it's not getting any better.
I mean, I still remember in the 80s, I'm an older adult, I'm 61, but I love longevity medicine. So I'm all with you there because as an older adult, I want to stay healthy as long as I can. Of course, I mean, there's no way the body will eventually break down and we will die, and that's fine. But I don't want to end up demented in a nursing home, and we know we can
For
prevent
sure.
it. And you do a lot of strategies to do that. What strategies do you use in your practice to uh, help alleviate or heal chronic illness?
Yeah. Yeah. So we're anti-aging physicians, as you mentioned. And so there's a lot of parts to that. Most of them, again, it comes back to lifestyle. You clean up one's diet. I mean, it's getting out the processed foods and, eat real whole foods and try to, most people are, especially here in the Midwest, we have a lot of people that are overweight, and so, or morbidly obese, and so working with somebody on their weight. And other things we like to do is optimize hormones. We feel like that's an important piece
Yes.
in longevity, for men and women. um and we certain supplements, now that's individualized depending on their needs and where they're at. And so you just kind of hit multiple aspects to do everything you can to help them to live a longer life. And ultimately we want to improve their health span, not just their lifespan, because what good is it to live to be 100 if you're going to be disabled for 20 years of that? And so I tell people we want to improve their health span so they're healthy and vibrant. And so I think we focus on decreasing risk factors for the big ones, which are cardiovascular disease, diabetes, Alzheimer's disease, those kinds of things, because the cancer, and that those are the big killers. And so if we can decrease risk factors for those, then that's important. And as far as longevity and stuff as well.
Oh, that's a good point, especially the way that you work. And what do you consider the main risk factors for those diseases? And I'm pretty sure it's not the same that a conventional medical doctor would say.
Yeah. So first thing that comes to mind is going to be what I refer to as metabolic health. And I think metabolic health is kind of a big term, but it's how well we process our calories and glucose and things like that. And most people, at least around here, are very metabolically unhealthy, and because again, the foods we eat, the lifestyle that we live, and they're stressed all the time. I mean, there's a lot of pieces to that. But metabolically unhealthy people are going to obviously be at increased risk for diabetes, which puts you at risk for all kinds of things. It's going to put you at increased risk for cardiovascular disease, and Alzheimer's disease has, some people refer to as type 3 diabetes, because it's been linked to the elevated insulin and insulin resistance, and so that's the first thing that comes to mind. Again, there's a lot of things we could talk about, but metabolic health would be the first thing I would tackle.
Yeah, that's a really good point. And for chronic illness, I love the image that Dr. Dwayne Bredesen puts in his book, The End of Alzheimer's, of the leaking roof. He said, if your roof has 36 holes, it's not enough to just plug one. You have to find and then plug one after the other until the roof is fixed or put a new roof on it. And
Yeah,
it's really what we do as functional natural health providers, that we fix all holes that we can find, not
sure.
just
Yeah.
one and put a band-aid on it.
For sure. Yeah, yeah, yeah. There's definitely multiple things, and obviously it's going to be individualized, depending
Mm.
on, the patient's history and uh, and their, all kinds of things. So,
So let's just assume that somebody's listening to that, just like myself, an older lady, 61, wants to stay healthy and well up to 100 or whatever. And I would come to you and say, Break, oh, Dr. Dennis, what can you do for me? How can you help me? What would you say? What would you do?
yep. Well, first I always start out getting some blood work on somebody, and I usually will do my own just because I get a few. I don't get crazy things. Some functional medicine doctors get $1,000 worth of lab, and that's okay. That may be warranted in certain situations, but I mean we get mostly basic stuff. But what I'm looking at is again your metabolic health, and I check that through a fasting insulin level as well as I do like looking at lipid panels. I look at it a little differently than most, but I'm looking at HDL cholesterol and triglycerides. Um, and I'm going to look at hormone levels. I'm going to look at vitamin D levels. And so I look at all those things. And so I'm going to, once I get all those lab results back, then I'm going to teach them how to improve their metabolic health. And that's through changing their diet up a little bit, in many cases, changing it up a lot, maybe some intermittent fasting and get moving, exercise. I really focus on uh, well, and especially for women, is building or at least maintaining muscle. I feel like muscle is sometimes not talked about enough, and I feel like muscle is very important for longevity, and also for again metabolic health. And so, unfortunately, nature works against us in that. Something called sarcopenia, which is the loss of muscle as we age, and so um, we really need to prioritize muscle. So I talk about that and how to do that, which is hormone optimization, prioritize protein, and then you got to work the muscles through exercise. And so we talk about all that. I'm going to want to optimize your vitamin D levels, and I'm going to want to optimize your hormone levels. That could be thyroid, and that most likely in a 60-year-old woman, that's going to be other the sex hormones, estrogen, progesterone, testosterone, which I'm a big advocate of what we call hormone optimization.
Yeah.
We use bioidentical hormones. I am not a fan of the estradiol and Premarin and those oral medications, but we like bioidentical hormones. And so if somebody is going to a practitioner that is trained in that, and really hormone replacement therapy, in my opinion, is an art. And so you really want to find somebody that kind of knows what they're doing and will work with you. But I would want to optimize hormones, because not only is that going to help with longevity, to decrease risk of osteoporosis, decrease risk of Alzheimer's disease, again, be able to help maintain muscle, but it also makes you feel better. When you have your hormones optimized, then you're going to have more energy, you're going to sleep better, you're just going to focus more, your libido is going to be improved. So it really improves all aspects and quality of life.
Oh, that's amazing. So I think that those are all very valid options. And that's just a small fraction of what you do in your practice. So if somebody really likes what you do, how can they find you? How can they contact you?
Yeah, probably the best way is through our website. It's Vibrant Life DC, which stands for Vibrant Life Direct Care.com. And then, it talks all about our services and what we do. And then also my podcast is on there. And I have a podcast called Fit RX. And I didn't talk about that, but kind of, as I was learning, doing this deep dive, and learning all this stuff on my own about health and wellness and longevity, and I read all this stuff, and and I couldn't get enough of it. And I thought, well, gosh, I'm just going to start a podcast and, start talking about all this stuff, that I've learned. And so anyway, that's what I did a little over 2 years
Awesome.
ago. So
Yeah,
it's been,
I looked at the podcast and sorry, I didn't mention it, but it's a great one. And I listened to a few episodes and you share very important information. So I
yeah.
recommend that to all. And I will put the links to it underneath too.
Yeah. Well, thank you. Yeah. Thank you for that. So,
of course, I love podcasting. I do my own because I love sharing stories and every podcast is different. So it is fascinating. And I love sharing podcast episodes from fellow practitioners that do really good work like you do.
yeah. Yeah. Thank you. Yeah.
So what's your website to send people to?
Yep. vibrantlifedc.com.
That is easy to remember. I'll also put that underneath your video and in the audio file note. And that's it for today. I thank you very much for being on my show today.
It's my pleasure. Thank you for having me.
This marks the end of this episode of Sparkles for Mental Health Growth in 5 Dimensions. Make sure to subscribe to the show and tune in to the next episode. Bye-bye.